So, Happy New Year to all of you. We will start with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. Seeking tribute to our Master Samuel Hahnemann, who taught us dare to be wise. Taking blessings from our Guru, Dr. Prafull Vijayakar, sir. Pranam Guruji. Homeopathy is mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraय Namaha. So friends, आज हम शुरू करने जा रहे हैं एक नया चैप्टर, रीडिंग क्लब। तो हम शुरू करेंगे ऑर्गेनोन की एक फर्स्ट एफोरिज्म से, और फिर हम सर का बुक पढ़ेंगे, थियरी ऑफ सेपरेशन। So the first aphorism what master has given to us is, we all know this aphorism. The physician high and only mission is to restore the sick to health, to cure as it is termed. हमें पता है कि हमारा मिशन क्या है। हमारा मिशन है जो सिक है उसको क्योर की ओर ले जाना। ठीक है, तो कैसे ले जाएंगे? तो मास्टर ने बहुत सारी टिप्स ऑर्गेनोन में दी हैं, और हम आगे आगे पढ़ते जाएंगे तो ये पता चलेगा कि कैसे हम कर सकेंगे। फुटनोट में कुछ लिखा हुआ है, however to construct the so-called system, his mission is not by intervening empty speculations and hypotheses concerning the internal essential nature of the vital processes and the mode in which disease originates in the invisible interior of the organism, whereon so many physicians have hitherto ambitiously wasted their talent and their time, nor is to attempt to give countless explanations regarding the phenomena and their proximate cause, which must ever remain concealed, wrapped in unintelligible word and an inflated abstract mode of expression which should sound very learned in order to astonish the ignorant while sick humanity sigh in a vain for aid. Of such learned reveries, to which the name of theoretic medicine is given and for which special professorship are instituted, we have had a quite enough, and it is now high time that all who call themselves physicians should at length cease to deceive suffering mankind with mere talk and begin now instead for once to act that is really to help and to cure. तो इसमें हनीमान ने कहा है कि हम ये नहीं जानते कि डिजीज का ओरिजिन कहाँ से है। ठीक है, हम ये जानते हैं कि डिजीज का ओरिजिन सिर्फ मटेरियल कॉज में है। Can mute your mic? Yes, great. सो हम नहीं जानते हैं कि डिजीज का ओरिजिन कहाँ है, पर हनीमान ने जब ये प्रोसेस शुरू किया तब उसे पता था कि समथिंग इन द इंटीरियर ऑफ द ऑर्गेनिज्म द डिजीज इज ओरिजिनेटेड. So lot of physician has vested ambitiously for his talent in searching for that, but nobody can do that, and Hahnemann has done that. And all the physicians who have made this professorship and they learn that this is nothing but this is the material cause, so they have to treat the material cause only. And in the treating of that material cause, they ignore the sick. And that is what Master Hahnemann is telling us in footnote number 1. So cure क्या है? Cure है पेशेंट को सही तरह से ठीक करना, उसको सिक स्टेज से क्योर स्टेज में लेके जाना. ठीक है, सो हम आज शुरू करेंगे थियरी ऑफ सपरेशन. सो वी विल गोइंग टुवर्ड्स द थियरी ऑफ separations. Is screen is visible to all? Write yes in chat box. Okay, fine, great. सो हम आज पढ़ने जा रहे हैं सर का फर्स्ट बुक जो सर ने 1997 में लिखा था, डॉक्टर प्रफुल्ल विजयकर. तो हम आज पढ़ेंगे ऑथर के बारे में कि सर क्या थे, क्योंकि आज हमारे बीच सर नहीं है पर हम मिल चुके हैं सर से. सो अबाउट द ऑथर. In every field during a particular era, there is an individual who stand up to a cause. There is a north star in the sky to guide the navigator, who might erringly go astray while reaching his destination. The star gives direction to sheer stability. So ये सर कहने चाहते थे कि कहीं ना कहीं आपको एक गाइडिंग मिल रहा है. In order to achieve anything in life, the foremost requisites are belief in oneself and positivity. This quality is not to the extreme of the fanatic who just forces his view on the other just because he thinks he is right. The positivity here is based on years of experience and supported by the proof. The confirmations are through basic universal accepted laws. The theories put forward are an awareness, a stimulus, or a desire to revive a science that man foresaw. More than 2 centuries ago, homeopathy as such is widely accepted throughout the world. It's, it especially has a very firm footing in India thanks to the dedicated physicians in this field. The popularity seems to have stemmed from the fact that the homeopathic medicine is very safe, easy to take, and has a panacea for their ailments at their own whims and fancy whenever required. The above thoughts and so many other frustrating situations in the practice spread over 22 years set Dr. Prafull Vijayakar's mind ticking for that something more in the practice which was already given him kudos. Dr. Prafull Vijayakar is an eminent classical homeopath of Mumbai city. He is an honorary physician at the Government Homeopathic Hospital at Irla, Mumbai, and a very active worker in the Indian Institute of Physicians. This is a national organization and Dr. Vijayakar lead this association as a president at the Mumbai level. It was through his dedications and untiring effort that association is doing good constructive work in homeopathy. He is also the joint secretary All India IIHP in charge of Gujarat, Maharashtra, Goa and Karnataka. Dr. Vijayakar with his powerful oratorship and commands over his subject has won laurel in all his seminars, lectures. Homeopathy, as he says, is based on the immutable law of science and nature. This, coupled with the vast experience seeing around 200 patients per day, has made him very firm in his belief in the scope of homeopathy. See how beautifully Sir is doing his work, 200 patients a day. He is the one to the fight for the right cause. Hence, with his positive attitude and forceful drive, he move on confidently on his chosen missions. It means propagations of the right homeopathy. He believes striking at the root, hence his lectures are aimed at stimulating and encouraging the young upcoming practitioners of the homeopathy. Believing in selfless service, he is always ready to share all his new ideas in practice and help others to road of success. Dedication, commitment, untiring effort in practice and depth of study in all required branches of the medicine has helped him to explain the basis of principle of homeopathy. He is the pioneer in these scientific explanations. Through his famous Dr. Vijayakar chart of suppressions, the seven layer of suppression of the disease and then cure in the opposite direction, it is thus that Dr. Vijayakar marches on, full of positivity and vibrant energy, and confident in his study of classifying homeopathy. With his omnipresent wit and ardent study, he has an answer for every query, thus making him very popular, being a firm believer in cosmic science and astrology and phenomenon like lunar aggravations, predispositions, physiognomy, all predictions like mathematics are Dr. Vijayakar's forte. That is why it is called as predictive homeopathy. The conviction with which he predicts the course of the disease after the stimulant is administered should be seen and believed. Hence, his stress on the importance of follow-up. So, हम ये बुक क्यों पढ़ रहे हैं उसका एक पॉइंट यहाँ सर ने बता दिया कि it is for the importance of follow-up. So whenever patient comes to you, you need to understand what is right and what is wrong. Dr. Vijayakar has a penchant for traveling, enjoy natures, driving, music, drawing, handicraft, poetry, a voracious reader and a fun-loving person with a strong family tie. He has been able to put into print the first of his publications of the series of these three books. The first one is Theory of Suppression, the second one is Theory of Acute, and the third one is End of My Assumption of Miasm. It will be pleasure to receive a feedback from all of the enthusiastic readers toward the unity in homeopathy or de sapere. So this is what about the Dr. Vijayakar sir. The energy and aura of the sir gives us the knowledge and the understanding of the disease in each and every aspect. So this is what my personal experience with the sir. So we are starting with the introductions of these books. So introduction. There is a fathomless chasm existing between the homeopathic principle and the science. It has been deepened by the misunderstanding of the principle and misconception which have prevented each of them to be benefited by the mutual interactions. So this is book an humble attempt to bridge this chasm. Sir always says bridge the older knowledge with the modern science. So Sir always bridging the Hahnemann to the modern era. Hahnemann was far ahead of at that time. Still, this modern era prove that Hahnemann is right. So, sir always bridges this. This work of mine on the theory of suppression is based on the basic principle of immunology, genetics, embryology, human biochemistry, and neuroendocrinology. See what sir has made all the science into one. This is an attempt by me to remove homeopathy from age-old confinement of being a blind symptom-based science or a mystic science and introduce it to the world as a post-modern scientific science. I have just put forth before the homeopathic world a concrete chart of suppression and direction of the cure, which, if properly understood, will remove the element of uncertainty and law of success rate prevailing for centuries in homeopathy practice. So sir says this theory, if you follow properly, you will have a proper understanding of the disease going towards in the right direction or wrong direction, and your success rate has been increasing. This is by no means a flawless theory. With this in mind, I would like to end this forward by asking fellow homeopaths who read this book to use my chart in a daily practice and try to confirm or rectify it with their own personal experience. Feedbacks and suggestions are welcome and will enhance the purpose of this book. This book, I hope, shall be the basis of more work in the future. With the blessings I yearn from the Father, Dr. Hanuman, we hope to rectify all that is wrong in the homeopathic clan. This is what the Ho sir has taken. We have to rectify the things which is wrong in the homeopathy. So I am keeping acknowledge later. I am just starting with the chapter 1. We are thanking sirs for these wonderful books to all of us. So forward, the first editions. The India is known for its medical science, in which homeopathy has a special status for the last 2 centuries. Unfortunately, homeopathy was pushed to the back seat during the British age. But late in the 20th century, not only in India, but the entire world, in a particular European countries, have realized the importance of this science. The credit goes to a few homeopathic doctors who are dedicated to these wings of medical science. Dr. Prafull Vijayakar is an eminent homeopath in the Mumbai. At a very young age, as a homeopathic doctor, not only has been made a name for himself, but he has also upgraded the status for his science. As a close associate of Dr. Vijayakar family, I have been closely observing the growing popularity of Dr. Vijayakar. The secret of this I consider is that his thinking is always patient oriented. So first and foremost, we need to learn from Sir's understanding is our thinking is patient oriented, not gaining materials and monies. The patient appearing before him is a subject of investigation. This results in a deep study of human body and which is the root causes of any sickness. As an ambassador of the Indian homeopathy, Dr. Vijayakar has been propagating this science in many other countries. Normally, the diagonal of disease is done in an isolated form. This same time resulted in further complication. New Dr. Vijayakar has done some very brilliant research in classifying the human body along with the medical problem into 7 regions. The clarity of research is so evident that this book will serve as a doctor to a family for a remedial purpose. Nobody ever thought that even a small scratch on the body, if ignored at the initial stage, might travel across the 7 seas and land into the cancerous death trap. This is what Sir understanding is. Having undergone major bypass surgery recently, I am very conscious of the importance of this book, not only for the preliminary precautions, but also for the post-operative care to be taken after major operations. His father being a doctor, Dr. Prafull Vijayakar has a very high traditions of medical science and is a God-gifted child. The research of classifying the body into 7 parts. This is what the foreword says that Pramod Navalkar minister had written this foreword. The research of classifying body into 7 parts, which have been successfully done by Vijayakar, will be watershed in the homeopathy world, and I am sure it will serve as a fuel for a flight of his suppressed wings of medical science around the world. So he wished Dr. Prafull Vijayakar, the best of luck. I am confident that this book will be the path breaker leading this science into 21st century. Pramod Navalkar, Minister, Transport, Cultural Affairs, Post Protocol, Prohibition, Propaganda, and etc. So this book is giving us a wings to understand the patients and where the patient land up into either a cure or into either a deteriorating state. So this is what our compass, this book is a compass for guiding us in our clinical practice. And since the 15 years of 16 years of my practice, I am using this compass that I am wrong somewhere and I am going towards the right direction somewhere. So this is what compass we had. So starting with the chapter first, the theory of suppressions and progression of the disease. In the world of homeopathy, every homeopath seems to be claiming excellent result, be it with 4 to 5 medicine at a time, with a multiple repetition in a day, or a single medicine, single dose. There are scores of homeopaths, both non-qualified and qualified, unfortunately, who have been making disease and symptom disappear in a patient, oblivious of what happened next. All the same, they all seem to vouch for their result. Now, the $1,000,000 question is, what is the homeopathic result? See, many a time we claim that this is what gone. The skin eruption has been gone. But sometime what happened after 2 years or 3 years, the patient came with the complaint of asthma, and then we understand that we might have suppressed these things. So this is what sir is, and what is the result of homeopathy. So sir given a case, Mr. VG, aged 19 years, had suffered from asthma ever since childhood, from 12 to 15 years. After having been treated homeopathy for a period of 6 months, she was so much so happy. She had no attack for 1 year. A year later, she came back with a severe relapse, the acute asthmatic attack, and could not be controlled by her general physician. And she had to be hospitalized. Nevertheless, the patient herself and her parents were happy with the homeopathic result, which had prevented her from getting regular asthmatic attack for last 1 year. You know, an intelligent homeopath is a one who assess his result by quality and not by quantity. So एक साल अच्छा रहा तो हम मान लेते हैं कि पेशेंट अच्छा है, पर उसके बाद कुछ हुआ, that is what something is mishappening. So absence of an attack for some time should be followed, if at all, by milder attack. This is in keeping with the true homeopathic result. A homeopathic medicine cure a patient by decreasing his sensitivity of an allergen, in short, reducing the intensity and frequency. So this is what very important. This line, you have to keep this line into understanding. A homeopathic medicine cure a patient by decreasing sensitivity of an allergen, in short, reducing the intensity and frequency. So whenever any patient comes to you with the allergy, what our medicine do? Our medicine do this. Our medicine does not treat that allergy, but our medicine makes the sensitivity to allergen normal. Hence, the homeopath strengthens the patient and weakens the disease. In these above mentioned cases, there was evidence of the strengthening of the disease. Hence, it goes without saying that one has to encounter symptoms and signs in a patient which shall indicate weakening of the patient as a whole. So क्या हुआ, ये जो patient case में temporary patient को ठीक लगा, पर उसके बाद the intensity has been increased. So that means it is a weakening of the patient. Okay. So weakening of the patient as a whole may mathematically point out that generals and mentals are deteriorating. So see, I am putting the notes that will help you, that you have to keep in the mind. Further, the interrogations revealed the following fact: the girl who used to study on her own and secure a high percentage of mark had become dull in study in the last year or so. Her interest in study has waned. She would feel bored to study and would feel sleepy in her classes. Her performance in maths had gone down. Alarmingly, her eyesight had deteriorated over the years. Her mother complained that this was due to her not feeling hungry at all nowadays. She had disturbed sleeps and dangerous dreams. All this was coupled with the loss of weight and dark circle increasing around the eyes. She was also alarmed by sudden and profuse loss of hair over the month. Is this a good or bad result? Please make your input in your chat box. Is this a good or bad result? Use chat box to give good result or bad result. Absolutely the bad result. Okay, so now we started understanding that this is what we have to understand in each and every cases when the generals. So this chapter will guide you two things. When your medicine has been prescribed, our medicine has to decrease the sensitivity to an allergens and reducing the intensity and frequency. And the second thing, when our medicine in the right direction, it strengthens the patients. Whereas if the patient is weakening, that means our medicine is wrong. This is what theory of separation tells us. So in the above mentioned case, the patient was cured of her chronic discomforting disease, but at what cost? At the cost of making her old and settling in a premature old age at the 16 years with falling hair, weakening of eyesight, loss of stamina for work and study, and even loss of interest in the study, which she loved before. So she understands the transient transfer from the miasm from the psoric state to the psychosis and psychosis to syphilis. We will read this in the later book, but this is what you have to understand. So we have to remember that our science, homeopathy, is a holistic science wherein we treat the man in disease and not diseasing man. So this is very important. Our homeopathic science is, see, I have to keep everything very noteworthy point, so I am making it as a note. It is obvious from the above fact that the disease has disappeared, but the man's health has not improved but has gone to the dogs. So this is what the things is the case. How many of us are aware of the fact that day in and day out, what we claim as cure may not be real cures and may be dangerous separation? So, this is the first chapter. We will read second chapter from tomorrow onwards. Okay, we will have a 10 minutes right now. So we will have a discussion for, so, and if you have any query and questions, let us put your questions or let it ask the questions in the chat. Any questions? What is the cause of suppressions and wrong medicines? Okay, good. Okay, I will note down all the questions and we will have a discussion on this. Great. We will make one day for the special case question and answer sessions. So the first things which what are the causes of suppression and wrong medicine? See, this is what we have to learn in this group. When we read this book gradually, we understand that our body is made up from the single cell to the multicellular complex mechanism, and it has some electrical potentials. So the certain electrical potentials, the highest in the brain and the lowest in the skin. So when this electrical potential has been reversed with the toxic medications or with the having suppressions by either a homeopathic medicine, that can lead to this. So there are the causes which is this. Sometimes the vaccination also suppress, sometimes the medicine also suppress, even a homeopathic medicine can suppress it. Okay. Dr. Brunda has asked one question that till what time we need to wait after prescription to judge whether disease is suppressed or not. It is based on that what disease you are treating. Either you are treating for acute case, you need to wait for a few days, and if you are treating a chronic case, you need to judge within 1 or 2 months that your medicine is in a right direction or wrong direction. Because the generals gives you guideline that your medicine, your patient is going into state of suppressions or the patient is going towards the cure, because generals is the indication. Dr. Raj Bhimani asks that what mental should we consider in the follow-up as a person, what mentals should we consider in follow-up as a person is curing. So this is what clearly mentions in aphorism number 253, the sign of improvement. Okay. So in sign of improvement, the first and foremost things that the general comfort. So patient ऐसे ही आके बता देगा कि नहीं सर आफ्टर मेडिसिन आई एम फीलिंग बेटर. This feeling better is not just the feeling of emotion. Feeling better means in the core the patient is telling you that my stress was reducing, I am working in a proper sense, and my stamina has been increasing, my capability has been increasing. So these are the some mentals which we have to understand. Sometimes a dull patients or dull children, when you prescribe a remedy, he got a good marks. So I had a case of one autism, a mild autism, and after a prescription, the mother says now he started learning properly, and previously he used to get 1 or 2 marks out of 10. But right now he used to get 7 or 8 marks. So this is something that his intellectual capacity has been increased. So when you ask about the mental, so mentals considered to be a first will, second is the intellect, third is the moral. Okay, so in the will power, will to work is increasing. In the morals, the moral become a normal. So the non-diligent or non-conscientious become a diligent, should work toward the diligence. Okay. And in the intellect, his intellect to deal with the situation has been improving. So this is what the mental should be considering persons. In case of OCD, after medicine, mania has reduced, but sexual function is not improved, not allowing husband to have relationship. Is it good follow-up or bad follow-up? Uh, so it is from the patient perspective or husband perspective, Dr. Siddesh. If it is from the husband perspective, then husband might have a more sexual desire. But first and foremost thing, we need to make making calm of the patient. So OCD has to be reduced. Mania has been in OCD. There is a compulsion. It is something different than the mania. Okay. So compulsion has to do with something, and sometimes it is compulsion related to the dirtiness at the level of sexual function. So it happened that sexual function has not been improved because you have not removed the cause. So mania is the transient phase, whereas the cause of this OCD is certain in the mind is dirtiness. So that dirtiness has to be removed. So if that cause is removed, this function also improves. Hope you got this. Still, the cause is not removed. So sometimes your medicine might be a partial or nearer to the simillimum. It's the same thing we need to ask. In a chronic case, we need to wait for certain time. So hope you all enjoy this morning sessions and learnings of this great readings of this great books of sirs. So we will meet daily from 6 a.m. to 6:40. We will keep our time very short and very precise. So that will help you all the short learning with big tips. So I am here to give you all things what I learned from Vijayakar sir and Master Haneman's books. So this is what I am sharing with all of you. Any questions you can ask me on the WhatsApp chat and the group you are there. So to ask me directly on my mobile number, which was given in the message. Okay. Thank you, Dr. Rashmi. I welcome you. You can unmute and we will have a 5-minute chat.
नमस्कार सर, कैसे हैं?
बस बढ़िया है आप बहुत दिनों बाद मिले हम
हाँ जी सर, थैंक यू सो मच. दिस इज सच अ नाइस एंडेवर. कल पढ़ते ही बहुत मजा आया एंड आई थॉट I'll definitely join in.
Thank you, ma'am. It is all sir's blessings. So just because of sir's blessings, I am doing my work, and that's all for the nature.
Definitely sir.
Thank you. Thank you all. We will end this meeting now. And if you have any queries and questions, let me know in the chat box or let me know into my personal message box. Thank you. Namaskar.